Dear friend, it all starts with something so ordinary your morning. On your plate, toast, eggs, maybe a few slices of orange or a small glass of juice. And next to it, like every day, is your morning medicine. You don't think about it. It's routine, comforting, even, but inside your body, something is wrong. Something silent, something dangerous. That orange, tangerine, grapefruit juice. It could be blocking the very pill that's supposed to protect your heart. Here's a surprising fact. A glass of grapefruit juice can block important blood pressure medications for up to 72 hours. According to the Mayo Clinic, it interferes with the enzyme that helps your liver process more than 85 common medications. That means your medicine could stay in your bloodstream too long or not work at all. Have you ever wondered, why don't I feel any different even though I take my medication every day? Or why is my doctor increasing my dose? These quiet doubts may not come from your age, your body, or your illness. They may come from your breakfast. This video may change the way you think about food, timing, and your medications. I'm Dr. Jarek, and on this channel, we walk together gently but firmly toward better health. The truth is, after age 55, our digestion changes, absorption slows down, stomach acid decreases, and with that, the absorption of medications becomes more sensitive. This isn't about avoiding nutrients. It's about understanding how food and medications interact, especially in older adults. Most doctors don't have time to explain these things in detail, but you deserve to know. In this video, you'll discover the 5 most dangerous food and drug combinations that affect seniors the most. You'll learn how calcium cancels out thyroid medication, how fiber interferes with heart medications, how vitamin supplements block antibiotics, and why mixing alcohol with painkillers can do more harm than just your stomach. Most importantly, I'll show you how to fix these problems and what questions you can ask your doctor today. You'll not only gain knowledge, but you'll also gain real control. Let's start with one of the most common and dangerous mistakes: grapefruit and blood pressure medication. Grapefruit. It's refreshing, tart, and packed with vitamin C. For most people, it's a healthy breakfast choice. But for people taking certain medications, especially those for blood pressure or cholesterol, it can be a potential hazard. And it's not a minor problem. It can lead to dangerously high levels of the drug in your body, even if you take the correct dose. Here's why grapefruit is tricky. It blocks an important enzyme in your small intestine called CYP3A4. This enzyme helps break down many medications so they're gradually absorbed into your system. But when you drink grapefruit juice, that enzyme is inhibited. As a result, more of the drug enters your bloodstream and stays there longer, increasing your risk of side effects like dizziness, kidney damage, and even heart rhythm problems. According to the Mayo Clinic, grapefruit can interact with more than 85 prescription drugs, including common blood pressure medications like felodipine, nifedipine, and some statins. And the effects aren't short-lived. A glass of the juice can affect your enzyme function for up to 72 hours. So, what can you do? First, check to see if any of your medications are on the grapefruit warning list. Most calcium channel blockers used for blood pressure, statins used for cholesterol, and anti-anxiety medications like buspirone are affected. If you're not sure, ask your pharmacist or doctor. They'll know. Second, avoid grapefruit juice and fresh grapefruit at least 4 to 7 hours before and after taking any affected medications, or better yet, eat little grapefruit. If you regularly take those medications, orange juice, apple juice, or water are safer alternatives. Finally, always read the information sheet that comes with your medication. If it says avoid grapefruit, take it seriously. It's not just a suggestion. Next, we'll look at another common interaction that surprises many seniors: how calcium supplements can interfere with your thyroid and bone-strengthening medications, and what to do instead. Calcium is important. We hear it everywhere: strong bones, healthy teeth, protection against osteoporosis. But what most seniors don't realize is that when you take calcium at the wrong time, it can secretly block medications that are supposed to help your thyroid or protect your bones. This is an easy mistake to make. After all, calcium supplements are often labeled as best taken with food. But what if your other medications, especially those for thyroid or osteoporosis, need to be taken on an empty stomach? That simple overlap in timing can make your body significantly less able to absorb them. Let's talk about levothyroxine, the most prescribed thyroid medication in the world. It's incredibly timing sensitive. Studies from the Cleveland Clinic show that calcium can reduce levothyroxine absorption by up to 80% when taken together. It's not a small mistake, it's a health mistake. And the effects can sneak up on you: fatigue, weight gain, depression, dry skin symptoms that may seem like aging, but are actually signals that your thyroid hormones are not hitting their targets. We saw this happen with Margaret, 65, a retired teacher in Ohio. She took levothyroxine every morning right after breakfast, along with coffee and her usual chewable calcium tablet. For months, she felt unwell. Her energy was down. Her weight was up despite no changes to her diet. Tests showed her TSH level was out of range. But her doctor didn't change her medication. He changed the timing. She was told to take her thyroid medication first thing in the morning on an empty stomach with only water, and then wait 30 to 60 minutes before eating or taking anything else, especially calcium, iron, or magnesium. 2 months later, her TSH was stable. Her energy returned. The solution wasn't a new medication, it was knowing when to take the right medication. And it's not just thyroid medication. Bisphosphonates commonly used to treat osteoporosis, such as alendronate Fosamax, also require strict timing. They require you to be on an empty stomach and upright for at least 30 minutes. Add a calcium-rich breakfast or supplement too early, and their absorption will be greatly reduced. So here's what to do. Take your levothyroxine or bisphosphonates as soon as you wake up, with a full glass of water. Wait at least 30-60 minutes before consuming any food, drink, or supplement, especially calcium, iron, antacids, or fiber. If you take calcium or a multivitamin, schedule it for lunch or dinner. Timing isn't just about convenience, it's about effectiveness. Even the best medication can be ineffective if it's blocked before it has a chance to work. Next, we'll explore something that most seniors think is healthy, but can backfire when taken at the wrong time: high-fiber foods and heart medications. You don't want to miss out. Fiber is the hero of most health conversations. It lowers cholesterol, aids digestion, balances blood sugar. But here's a little-known fact. In some cases, fiber can act as a thief, quietly sweeping medications out of your body before they have a chance to work. It all depends on the timing and the amount. When you eat a meal high in insoluble fiber, think oat bran, flax seeds, beans, whole grains. The fiber can bind to certain medications in your digestive tract, forming a kind of net that slows or even blocks absorption. That means your medication may move through your system too quickly to do its job. According to data from the National Institutes of Health, a high-fiber meal can reduce the absorption of drugs like digoxin, lithium, and carbamazepine by up to 35%. These aren't small medications. They include heart failure drugs, mood stabilizers, and seizure medications where every milligram counts. Let me tell you about Joe. 78, a retired machinist in Milwaukee. Joe lived with atrial fibrillation and took digoxin every day. He also took pride in his heart-healthy breakfast steel-cut oats, chia seeds, and a tall glass of prune juice. It was a great routine, until it wasn't. Over time, Joe noticed a flutter in his chest. He felt lightheaded after standing up. His heart rate became erratic. A cardiology visit revealed something strange. His digoxin levels were too low despite his perfect compliance. The cause: his high-fiber breakfast had bound to the drug, preventing it from being absorbed. After Joe adjusted his routine, taking his heart medication an hour before breakfast, his symptoms improved and his heart rate returned to normal. This isn't a reason to avoid fiber, it's a reason to respect timing. Here's what you can do. If you're taking medications like digoxin, lithium, levothyroxine, or certain antibiotics, avoid taking them within an hour before or 2 hours after a high-fiber meal. If your breakfast is high in fiber, consider taking your medication earlier with just water and eating 60-90 minutes later. For extended-release medications, check with your doctor. The medication may be less affected, but not always. Fiber isn't the culprit. It's a powerful tool when used judiciously. A cup of coffee in the morning, a glass of wine with dinner. These are simple pleasures, little rituals that bring comfort, rhythm, even joy. But if you're taking certain medications, particularly NSAIDs like ibuprofen or naproxen, these habits can become quietly dangerous. It all depends on a delicate layer, the lining of your stomach. NSAIDs or non-steroidal anti-inflammatory drugs are ubiquitous. They're found in over-the-counter medications like Advil, Aleve, and even prescription pain relievers. They work by suppressing inflammation, but in the process, they also thin out the protective mucus in your stomach, making the lining more vulnerable to acid. Now imagine that same already thinner stomach exposed to two more irritants, alcohol and caffeine. According to Harvard Health, older adults who combine NSAIDs with alcohol are 4 times more likely to experience gastrointestinal bleeding. And what about caffeine? It stimulates acid production, which can make irritation worse. Add to that aging when the stomach heals more slowly and the risk increases. Here's how to stay safe. Always take NSAIDs after a full meal with food acting as a buffer. Avoid alcohol altogether while taking these drugs, especially within 8 hours of your last dose. Combining alcohol and NSAIDs significantly increases your risk of bleeding. Limit caffeine, especially on an empty stomach. A cup in the morning is fine, but avoid it with NSAIDs. If you take NSAIDs regularly, ask your doctor about stomach-protecting options like proton pump inhibitors, GUG, omeprazole A. Also, be aware of hidden sources. Many cold medicines contain NSAIDs. Some herbal supplements can also thin the blood. When combined with your daily coffee or social drink, these layers of risk can add up quickly. The lining of your stomach is more than just a passive barrier. It's your body's first line of defense. And over time, even small daily habits can weaken that barrier unless you protect it. You don't have to give up comfort. You need clarity and consistency. Next, we'll explore another common mistake: mixing multivitamins with medications, and why even healthy choices like vitamin K or iron can hinder absorption if taken at the wrong time. Multivitamins may seem harmless. After all, they're designed to help right a little iron, a little vitamin C, a little zinc, or B12. But here's what most seniors don't realize when taken at the wrong time. Multivitamins can interfere with the very medications that are meant to heal or protect you. Let's start with a common example: antibiotics, particularly the quinolone and tetracycline families, like ciprofloxacin or doxycycline. When taken with a multivitamin that contains iron or calcium, antibiotic absorption can decrease by up to 40%. According to the World Health Organization, that means your infection may last longer or come back more severely. Then there's vitamin K, which is often found in multivitamins for seniors. If you're taking a blood thinner like warfarin Coumadin, fluctuations in vitamin K can throw off the balance. Too much. Your blood may clot too easily. Too little, you could bruise or bleed more. Now meet Frank, 74, from Indiana. He's diligent every morning at 8 a.m. He takes his medications and supplements all at once: blood pressure medication, a blood thinner, and a multivitamin for seniors. He thought it was working, but after his doctors noticed his INR, a measure of blood thinning, was fluctuating, they dug deeper. Turns out, Frank's multivitamin contained 80 micrograms of vitamin K, sometimes double what his body can handle. So what should you do? Check the label on your multivitamin. Look for vitamin K, iron, calcium, magnesium, or zinc, all common culprits for drug interference. Separate your medications and multivitamins by at least 2 hours, especially if you're taking antibiotics, thyroid medications, and osteoporosis medications. Don't take them all at once. Mornings may be convenient, but your body and your medications may benefit from a smarter schedule. Remember, more isn't always better. Even helpful nutrients can get in the way when they're too crowded. And as we age, as digestion and metabolism change, these timing details matter more than ever. You don't have to fear your multivitamin, but you do have to respect its power. In the final part of the video, I'll walk you through a clear summary and help you create a safe, effective medication routine, one that supports your body, not sabotages it. We've covered a lot together, from a harmless glass of grapefruit juice blocking your blood pressure medication, to calcium secretly interfering with your thyroid medication, from fiber pushing your medication out too early, to the hidden dangers of alcohol and caffeine with NSAIDs, and even the timing mistakes of multivitamins. Each of these combinations may seem harmless on their own, but for someone over 55 taking multiple medications, they can mean the difference between a medication that works and one that doesn't. I've seen this over and over with my patients. Not because they're careless, it's because no one ever told them about the importance of timing and food. But now you know, and knowing gives you power. If this video resonates with you, I invite you to subscribe to Dr. Jarek, where we build a foundation of better health through smarter choices without fear, without confusion, and without guesswork. The path to better health isn't about more pills. Sometimes it's about doing the right thing at the right time. So give your body the respect it deserves. You deserve it. We'll see you next time. Until then, stay smart, stay healthy, and stay in tune with your own health rhythm.